Question 1. A board-certified behavior analyst, BCBA, is designing an intervention for a client with severe challenging behaviors. Which of the following is the most important ethical consideration before implementing the intervention? A. Ensuring the intervention is least restrictive. B. Gaining assent from the client. C. Obtaining informed consent from the client or their legal guardian. D. Collaborating with other professionals. Answer: C. Obtaining informed consent from the client or their legal guardian. This question tests understanding of informed consent, a foundational ethical principle. The keyword "most important" highlights the critical initial step before any intervention. Informed consent ensures the client or their legal guardian fully understands the proposed intervention, including potential risks and benefits, and agrees to it voluntarily and with full capacity. Without valid informed consent, even the best intervention cannot ethically proceed. For example, a BCBA cannot start a behavior reduction plan for a child without the parents signing off on the plan, even if the child seems to enjoy the activities. Always prioritize obtaining informed consent before beginning any new service or intervention. Question 2. A BCBA is asked to provide services for a family member. What is the most appropriate ethical action? A. Accept the case, but only provide direct services, not supervision. B. Refer the family member to another qualified professional. C. Accept the case if the family member agrees to strict professional boundaries. D. Provide pro bono services to avoid financial conflict. Answer: B. Refer the family member to another qualified professional. This question addresses the ethical guideline regarding conflicts of interest and professional boundaries, specifically dual relationships. The most appropriate action when asked to provide services to a family member is to refer them to another qualified professional to avoid any actual or perceived conflict of interest or impairment of objectivity. Engaging in a dual relationship, where a professional and personal relationship coexist, can compromise the BCBA's professional judgment and client welfare. For instance, a BCBA should not become the service provider for their niece or nephew, even if they desperately need services, as this creates a significant conflict. Remember, maintaining objectivity and avoiding potential harm are paramount in professional practice. Question 3. A BCBA learns that a colleague is consistently using outdated and ineffective intervention methods that are not evidence-based. What is the BCBA's ethical obligation? A. Privately advise the colleague to update their practices. B. Directly report the colleague to the BACB. C. Ignore the situation if no direct harm has occurred yet. D. Consult with a supervisor or another BCBA about the situation. Answer: D. Consult with a supervisor or another BCBA about the situation. This question tests the ethical guideline on responding to ethical violations by other professionals. The initial step when encountering potential unethical conduct, especially concerning professional competence or ineffective practices, is to attempt to resolve the issue informally if possible, or to consult with a trusted colleague or supervisor. This allows for guidance and clarification without immediate formal escalation. For example, if you notice a colleague consistently using a non-evidence-based intervention, you would first talk to them directly or seek advice from a mentor before considering a formal report. The goal is to address the issue professionally and prevent potential harm to clients. Question 4. A client receiving ABA services shares personal information about a family dispute, unrelated to their behavior goals, with their BCBA during a session. How should the BCBA ethically respond? A. Document the information thoroughly in the client's record. B. Listen attentively but redirect the conversation back to the client's behavioral goals. C. Offer advice on how to resolve the family dispute. D. Share the information with the client's parents to facilitate resolution. Answer. B. Listen attentively but redirect the conversation back to the client's behavioral goals. This question focuses on maintaining professional boundaries and scope of competence. The BCBA's primary responsibility is to the client's behavioral goals within the scope of ABA. While listening empathetically is important, offering advice on unrelated personal matters or documenting them extensively goes beyond the scope of a behavior analytic practice. For instance, if a client begins discussing their parents' divorce in detail, the BCBA should acknowledge their feelings but gently guide the conversation back to their behavior program objectives. Your role is to address behavior, not to serve as a family therapist or counselor for non-behavioral issues. Question 5. When a BCBA receives a request for client records, what is the primary ethical consideration before releasing them? A. Whether the request comes from the client's legal guardian. B. The potential impact on the client's future services. C. Ensuring proper authorization and confidentiality. D. The format in which the records are requested. Answer. C. Ensuring proper authorization and confidentiality. This question highlights the ethical obligation concerning client record keeping and confidentiality. The keyword primary ethical consideration points to the most fundamental safeguard. Before releasing any client records, the BCBA must ensure there is appropriate authorization, such as a signed release form from the client or their legal guardian, and that all confidentiality standards are met, releasing only the information specifically authorized. For example, if a new school requests records, the BCBA must verify that the parents have signed a release form specifically for that purpose before sending anything. Always prioritize protecting client privacy and only share information with explicit, documented consent. Question 6. A BCBA is developing a behavior intervention plan for a child with a severe self-injurious behavior. Which ethical principle should guide the selection of interventions? A. Fidelity, ensuring trust with the family. B. Justice, ensuring fairness across clients. C. Beneficence and non-maleficence, promoting good and preventing harm. D. Veracity, being truthful about the intervention's success rate. Answer. C. Beneficence and non-maleficence, promoting good and preventing harm. This question centers on the core ethical principles of beneficence and non-maleficence, which are critical when designing interventions, especially for severe behaviors. Beneficence means acting for the good of the client, aiming to improve their life, while non-maleficence means doing no harm, minimizing risks, and avoiding ineffective or punitive procedures. For a self-injurious behavior, the intervention must be chosen to reduce the harm and improve the client's well-being effectively and safely. For example, a BCBA would select a function-based intervention to replace the self-injurious behavior rather than simply suppressing it, ensuring the chosen method is both effective and causes no undue distress. Always strive to maximize good outcomes while minimizing any potential for harm. Question 7. A BCBA is supervising a new RBT. The RBT asks the BCBA for advice on a personal relationship issue they are having. How should the BCBA respond ethically? A. Provide empathetic listening and general life advice. B. Advise the RBT to seek support from a friend or professional counselor. C. Document the conversation to ensure it doesn't impact their work performance. D. Change the topic immediately and sternly, reminding them of professional boundaries. Answer B. Advise the RBT to seek support from a friend or professional counselor. This scenario addresses maintaining professional boundaries in supervision. A BCBA's role as a supervisor is to provide clinical and professional guidance, not personal counseling. Offering personal advice can blur professional lines and create a dual relationship. For example, if an RBT asks for dating advice, the BCBA should kindly remind them that while they care about their well-being, such matters are outside the scope of their supervisory relationship and suggest consulting a personal confidant or mental health professional. It's crucial to distinguish between professional support and personal counseling to uphold ethical boundaries. Question 8. A BCBA's client has made significant progress and no longer requires intensive ABA services. What is the BCBA's ethical obligation regarding service termination? A. Immediately discontinue services to free up space for new clients. B. Continue services at a reduced intensity to ensure maintenance of skills. C. Plan for a smooth transition, including fading services and providing resources. D. Require the client to stay for a minimum period after goal attainment. Answer C. Plan for a smooth transition, including fading services and providing resources. This question tests the ethical guideline regarding discontinuing services. When a client no longer requires intensive services, the BCBA has an ethical obligation to ensure a smooth, planned transition, which may include gradually fading services, preparing the client and family for discharge, and providing necessary resources or referrals for ongoing support. Simply stopping services abruptly can harm the client's progress and well-being. For instance, if a child meets all their communication goals, the BCBA would work with the family to transition out of services over several weeks, ensuring skills generalize and providing recommendations for community support. Always plan for a responsible and client-centered termination of services. Question 9. A BCBA is creating an advertisement for their ABA services. Which of the following is ethically permissible to include? A. Guarantees of specific behavior change outcomes. B. Testimonials from current clients or their families. C. Objective information about the services offered and qualifications. D. Comparisons of their services to specific competitors, highlighting weaknesses of others. Answer C. Objective information about the services offered and qualifications. This question addresses ethical guidelines for public statements and advertising. BCBAs must ensure their public statements are accurate, objective, and not misleading. Guarantees of outcomes, testimonials from current clients, or disparaging competitors are generally prohibited because they can be deceptive or exploitative. An ethical advertisement should provide clear, factual information about the services provided, the BCBA's credentials, and how to contact them. For example, an ad can state board-certified behavior analyst providing evidence-based early intervention services, but cannot say guaranteed to reduce tantrums by 90% in 2 weeks. Always strive for honesty and transparency in all public communications. Question 10. During a home session, a BCBA notices signs of potential child neglect. What is the BCBA's ethical and legal obligation? A. Document the observations but do not intervene, as it is outside the scope of ABA. B. Inform the parents that the BCBA is legally obligated to report suspected neglect. C. Immediately report the suspected neglect to the appropriate child protective services. D. Discuss concerns with the client's guardian ad litem or legal representative only. Answer: C. Immediately report the suspected neglect to the appropriate child protective services. This question tests the ethical and legal mandate of reporting suspected abuse or neglect. BCBAs are mandated reporters, meaning they are legally and ethically obligated to report any suspected child abuse or neglect to the appropriate authorities immediately. The primary ethical principle here is non-maleficence, protecting the client from harm. For instance, if a BCBA observes unexplained bruises or severe unsanitary living conditions, they must make a report to Child Protective Services, CPS, according to their state's guidelines. Prioritize the safety and well-being of the client by fulfilling your mandated reporter responsibilities. Question 11. A BCBA wants to use a new, cutting-edge intervention that has limited research but shows promising preliminary results for a challenging behavior. What ethical consideration is paramount before implementation? A. Obtaining assent from the client, even if they are nonverbal. B. Ensuring the intervention is the least restrictive option available. C. Discussing the experimental nature and all known risks/benefits with the client/guardian for informed consent. D. Documenting a detailed behavior baseline for comparison. Answer: C. Discussing the experimental nature and all known risks/benefits with the client/guardian for informed consent. This question focuses on informed consent, especially when using novel or experimental interventions. The keyword cutting-edge intervention with limited research signifies the need for extra transparency. When using interventions that are not fully established as evidence-based, the BCBA must thoroughly inform the client or their guardian about its experimental nature, any potential risks, benefits, and alternatives, ensuring they understand and voluntarily agree to proceed. For example, if a BCBA proposes a new type of therapy that is still in research for a specific condition, they must explain that it's not yet widely proven and obtain explicit consent acknowledging this. Always ensure full disclosure, especially for new or experimental procedures. Question 12. A BCBA observes a supervisee engaging in a non-compliant behavior during a session with a client. What is the most appropriate first step for the BCBA? A. Document the behavior and report it to the BACB. B. Immediately intervene in the session to correct the supervisee. C. Provide immediate, constructive feedback to the supervisee after the session. D. Terminate the supervision relationship with the supervisee. Answer: C. Provide immediate, constructive feedback to the supervisee after the session. This question addresses the ethical responsibility of a supervisor regarding providing feedback and remediation. The keyword first step suggests an initial, direct approach. When a supervisee makes an error, the most appropriate initial action is to provide timely, specific, and constructive feedback, ideally soon after the observation, to help them learn and improve. For instance, if an RBT incorrectly implements a prompt, the BCBA should address it privately and constructively after the session, explaining the correct procedure and practicing it. Your role as a supervisor is to mentor and guide, not immediately punish, to foster professional growth. Question 13. A BCBA has been asked by a client's school to share the client's progress data with the school's general education teacher. What must the BCBA do before sharing any information? A. Obtain written consent from the client's legal guardian specific to sharing information with the school. B. Share only de-identified data that does not reveal the client's identity. C. Verify that the school has a legitimate educational interest in the data. D. Share the data, as it is generally considered part of the client's educational record. Answer: A. Obtain written consent from the client's legal guardian specific to sharing information with the school. This question focuses on maintaining client confidentiality and obtaining proper authorization for information sharing. Even when sharing information with other professionals involved in a client's care, such as a school, a BCBA must obtain specific written consent from the client or their legal guardian to disclose protected health or educational information. For example, if a teacher requests to see a child's progress report, the BCBA must obtain a signed release form from the parents that authorizes sharing information with the school. Always prioritize client privacy and ensure you have explicit, documented permission before sharing any confidential information. Question 14. A BCBA discovers a significant error in a previously submitted billing statement. What is the ethical action the BCBA must take? A. Correct the error and resubmit the statement without explanation. B. Correct the error, resubmit the statement, and notify the payer of the correction. C. Ignore the error if the difference is minor and unlikely to be noticed. D. Wait for the payer to identify the error before taking action. Answer: B. Correct the error, resubmit the statement, and notify the payer of the correction. This question tests the ethical guideline of veracity, or truthfulness, in all professional activities, including billing. When an error is identified, the BCBA has an ethical obligation to promptly correct it and transparently communicate the correction to the relevant party. This ensures honesty and maintains trust. For example, if a BCBA accidentally billed for 10 hours of service when only 8 were provided, they must immediately correct the invoice and inform the insurance company of the overcharge. Always act with integrity and honesty in all financial matters. Question 15. A BCBA receives a gift from a client's family as a token of appreciation. The gift is a small, inexpensive handmade item. What is the most appropriate ethical response? A. Politely decline the gift and explain the ethical code. B. Accept the gift as a gesture of kindness to maintain rapport. C. Accept the gift and reciprocate with a similar small gift. D. Accept the gift but immediately disclose it to their supervisor. Answer: B. Accept the gift as a gesture of kindness to maintain rapport. This question addresses the guideline regarding accepting gifts from clients. While BCBAs must avoid conflicts of interest and dual relationships, the ethical code allows for accepting gifts of nominal value as long as it does not create a conflict of interest, impair objectivity, or exploit the client. A small, inexpensive handmade item typically falls within this acceptable range and can help maintain a positive therapeutic relationship. For instance, accepting a handmade drawing from a child client is generally permissible as it shows appreciation without creating a conflict. However, politely declining larger or more valuable gifts is crucial to avoid any appearance of impropriety. Question 16. A BCBA is asked to attend a general staff meeting at a client's school to discuss the client's overall academic progress. What is the BCBA's ethical consideration regarding information sharing in this context? A. Only discuss the client's progress on ABA-specific goals, avoiding other academic areas. B. Share all information openly, as it is for the client's benefit. C. Ensure that all attendees have a legitimate need to know the information and that consent for sharing has been obtained. D. Share only de-identified information to protect confidentiality. Answer: C. Ensure that all attendees have a legitimate need to know the information and that consent for sharing has been obtained. This question focuses on client confidentiality and the need to know principle when sharing information. Before discussing a client in a group setting, even with other professionals, the BCBA must ensure that all present individuals have a legitimate reason to access the information and that appropriate consent for sharing has been obtained from the client or guardian. For example, before discussing a student's behavior plan in a school meeting, the BCBA must ensure parents have signed a release allowing information sharing with specific school staff and verify only relevant staff are present. Always safeguard client privacy by sharing only what is necessary, with proper authorization, and with those who truly need to know. Question 17. A BCBA determines that a client's current behavior intervention plan is no longer effective and may even be causing undue stress. What is the BCBA's ethical obligation? A. Continue the plan, but increase the intensity of interventions. B. Promptly modify the plan or discontinue ineffective procedures. C. Refer the client to another BCBA who might have more success. D. Seek a second opinion from another BCBA before making any changes. Answer: B. Promptly modify the plan or discontinue ineffective procedures. This question addresses the ethical principle of beneficence and non-maleficence, specifically regarding the effectiveness and potential harm of interventions. If a plan is ineffective or causing distress, the BCBA has an immediate ethical obligation to modify it or discontinue the ineffective components to ensure the client's well-being and progress. For instance, if a token board system is consistently failing to motivate a child and is causing frustration, the BCBA must promptly reassess, modify the system, or try a different approach. Your responsibility is to ensure interventions are effective and beneficial, not to continue practices that are not working or are causing harm. Question 18. When providing supervision, a BCBA should ensure the supervisee is competent for the tasks they are assigned. This aligns with which ethical guideline? A. Professional boundaries. B. Supervisory delegation. C. Client autonomy. D. Conflicts of interest. Answer: B. Supervisory delegation. This question directly relates to the ethical guideline of supervisory delegation. Supervisory delegation requires BCBAs to delegate only those responsibilities that a supervisee can reasonably be expected to perform competently, ethically, and safely. This means assessing the supervisee's skills and experience before assigning tasks. For example, a BCBA would not assign a brand new RBT to independently conduct a functional analysis without significant training and direct supervision, as it is beyond their initial competence. Always ensure that any tasks you delegate are appropriate for your supervisee's skill level and experience. Question 19. A BCBA is considering accepting a new client whose primary behavior concern is outside the BCBA's current area of specialized expertise, example severe feeding disorders, when the BCBA specializes in early intervention. What is the ethical course of action? A. Accept the client and learn on the job to expand their expertise. B. Decline the client and refer them to a BCBA with relevant expertise. C. Accept the client but only implement general ABA principles. D. Accept the client, but disclose to the family that the BCBA is not an expert in that area. Answer: B. Decline the client and refer them to a BCBA with relevant expertise. This question tests the ethical obligation to practice within one's scope of competence. When a client's needs fall outside a BCBA's current area of expertise, the most ethical action is to decline the case and refer the client to a qualified professional who has the necessary experience and training. Accepting such a client without adequate competence could lead to ineffective services or potential harm. For example, If a BCBA primarily works with toddlers and is asked to treat an adult with a traumatic brain injury, they should refer to a BCBA specializing in that population. Always prioritize client well-being by ensuring you possess the necessary expertise for the services you provide. Question 20. A BCBA uses social media personally and has friends who are also clients' parents. What ethical consideration is most important for the BCBA in this situation? A. Ensuring all personal posts are set to private. B. Avoiding any posts that discuss ABA or client information. C. Refraining from friending or interacting with clients/families on personal social media. D. Making sure their profile does not mention their professional credentials. Answer: C. Refraining from friending or interacting with clients/families on personal social media. This question addresses ethical guidelines for social media use and professional boundaries. Engaging with clients or their families on personal social media creates a dual relationship, blurring professional lines and potentially compromising objectivity and confidentiality. The most important ethical step is to avoid such interactions entirely on personal platforms. For example, a BCBA should politely decline a friend request from a client's parent on Facebook, explaining that they maintain professional boundaries. Remember, your personal online presence can impact your professional integrity. Question 21. A BCBA is asked to serve as an expert witness in a legal case involving a former client. What is the primary ethical responsibility regarding their testimony? A. Advocate strongly for the former client's best interests. B. Provide objective, fact-based testimony within their scope of expertise. C. Avoid testifying to maintain confidentiality. D. Only testify if compensated handsomely for their time. Answer: B. Provide objective, fact-based testimony within their scope of expertise. This question relates to ethical guidelines for forensic services and public statements. When acting as an expert witness, a BCBA's primary ethical responsibility is to provide objective, unbiased, and factual testimony based on their professional knowledge and available data, rather than acting as an advocate for any party. They must only speak within their area of competence. For example, if testifying about a child's progress, the BCBA would present the data and their professional interpretation, not opinions about parental custody. Your role in legal settings is to inform the court with professional, objective expertise. Question 22. A BCBA is developing a new research study. What is the fundamental ethical principle that must guide all aspects of their research? A. Maximum benefit to the profession. B. Confidentiality of data. C. Respect for persons. D. Efficiency of resources. Answer: C. Respect for persons. This question highlights the core ethical principle of respect for persons in research, which encompasses autonomy and protection of vulnerable populations. This principle ensures that participants are treated as autonomous agents, capable of making informed decisions, through informed consent, and that those with diminished autonomy are protected. For example, when conducting research, the BCBA must obtain informed consent from all participants or their guardians, ensuring they understand the study and can withdraw at any time. All research must prioritize the dignity and rights of participants above all else. Question 23. A BCBA is supervising a student who has not yet passed their RBT exam. Which task is the BCBA ethically prohibited from delegating to this student? A. Conducting a preference assessment. B. Implementing a skill acquisition program as directed. C. Modifying a behavior intervention plan independently. D. collecting ABC data during a session. Answer C. Modifying a behavior intervention plan independently. This question addresses the ethical guidelines for supervisory delegation and competence. Modifying a behavior intervention plan independently requires the judgment, expertise, and authority of a certified professional. An RBT or a student still training for their RBT certification is not ethically or competently permitted to make such decisions independently. For instance, a BCBA might instruct a student to implement a specific prompting procedure, but the student cannot decide to change the prompt level without direct BCBA guidance and approval. Always ensure that tasks delegated align with the supervisee's certification level and competency. Question 24. A BCBA identifies that a significant portion of a client's challenging behavior occurs during transitions. What is the most ethical approach to intervention planning for this behavior? A. Immediately implement a severe consequence for challenging behavior during transitions. B. Conduct a functional assessment to determine the function of the challenging behavior. C. Implement a generic transition plan from a textbook. D. Recommend medication review by a physician to reduce the behavior. Answer B. Conduct a functional assessment to determine the function of the challenging behavior. This question emphasizes the ethical requirement for effective and individualized intervention planning, grounded in the practice of applied behavior analysis. The most ethical approach for challenging behavior is always to conduct a thorough functional assessment to understand why the behavior is occurring. This ensures the intervention is evidence-based, tailored to the individual, and targets the behavior's function, promoting positive, lasting change. For example, before trying to reduce a child's tantrum during transitions, the BCBA would observe if it occurs for attention, escape, or access to items, then design an intervention based on that specific function. Always begin with a functional assessment to develop effective and ethical interventions. Question 25. A BCBA becomes aware that their services are no longer beneficial to a client and the client's progress has plateaued for several months. What is the BCBA's ethical obligation? A. Continue services, but at a reduced frequency to maintain skills. B. Discuss potential discontinuation of services with the client/guardian and explore alternatives. C. Increase the intensity of services to try and break through the plateau. D. Refer the client to a different BCBA without further discussion. Answer B. Discuss potential discontinuation of services with the client/guardian and explore alternatives. This question highlights the ethical responsibility regarding continuity and discontinuation of services, specifically when services are no longer beneficial. When progress plateaus or services are no longer advantageous, the BCBA has an ethical obligation to discuss this with the client or guardian, explore other options, and plan for a transition or discontinuation if appropriate. For example, if a child has mastered all their current goals and is no longer making significant strides, the BCBA should initiate a conversation with the parents about decreasing service intensity or transitioning to other supports. It's crucial to prioritize the client's current needs and avoid continuing services unnecessarily. Question 26. A BCBA is offered a substantial bonus by a client's parent if the client meets a specific, ambitious behavior goal by a certain date. What is the ethical response? A. Accept the bonus as motivation to achieve the goal. B. Accept the bonus, but ensure it's documented as a gift. C. Decline the bonus, explaining that professional fees are predetermined and not based on outcomes. D. Accept the bonus only if the client indeed meets the goal. Answer C. decline the bonus, explaining that professional fees are predetermined and not based on outcomes. This question tests the ethical guideline on fees, financial arrangements, and avoiding conflicts of interest. Accepting performance-based bonuses tied to client outcomes creates a conflict of interest, potentially compromising the BCBA's objectivity and professional judgment. Fees should be predetermined and not contingent on specific results. For example, if a parent offers extra money for their child to stop crying by a certain date, the BCBA must politely decline, explaining that their compensation is for services rendered, not specific outcomes. Maintain clear financial boundaries to preserve professional integrity. Question 27. A BCBA provides services to a child whose parents are in the midst of a contentious divorce. Both parents have legal custody. The mother requests that the BCBA not share any information with the father. What is the BCBA's ethical obligation? A. Comply with the mother's request, as she is the primary contact. B. Obtain a court order or written agreement from both parents specifying information sharing. C. Share information only with the parent who initiated services. D. Share information with both parents, as they both have legal custody. Answer: B. Obtain a court order or written agreement from both parents specifying information sharing. This question addresses confidentiality, third-party requests for services, and legal custody issues. When parents share legal custody and disagreements arise about information sharing, the BCBA cannot unilaterally decide which parent to share information with. The ethical and legal path is to seek clear directives, preferably a court order or a signed agreement from both parents, outlining how information is to be shared. For instance, if parents disagree on whether the father can receive progress reports, the BCBA should require a specific legal document or joint consent. Prioritize acting lawfully and ethically when navigating complex family dynamics to protect client privacy. Question 28. A BCBA plans to use physical restraint as an intervention for severe aggression. What is the ethical consideration that must be prioritized regarding this intervention? A. Ensuring it is the least restrictive intervention necessary. B. Gaining assent from the client, if capable. C. Training all staff extensively on its proper implementation. D. All of the above. Answer: D. All of the above. This question emphasizes multiple critical ethical considerations when implementing highly restrictive or intrusive procedures like physical restraint. Such interventions must be chosen as a last resort, meaning they are the least restrictive option after less intrusive methods have been exhausted. Additionally, gaining assent from a client, even if nonverbal, means observing for any signs of agreement or discomfort. Extensive staff training is also crucial for safety and proper implementation. For example, if a BCBA is considering physical restraint, they must first exhaust all positive behavior supports, ensure the intervention is absolutely necessary, obtain explicit informed consent, and ensure every staff member is highly trained and competent in its safe use. All these factors are vital for ethical and safe practice. Question 29. A BCBA has been asked by a local news outlet to comment on a high-profile case involving ABA. What should the BCBA prioritize when making public statements? A. Providing an opinion on the specific client's behaviors. B. Educating the public about behavior analysis in general terms. C. Criticizing other professionals involved in the case. D. Speculating on the potential outcomes of the case. Answer: B. Educating the public about behavior analysis in general terms. This question addresses ethical guidelines for public statements and media presentations. When interacting with the media, A BCBA's ethical responsibility is to educate the public about behavior analysis in a broad, objective manner, avoiding discussion of individual clients, specific cases, or disparaging other professionals. Their role is to disseminate accurate information about the science and practice. For instance, a BCBA might explain what ABA is and its general applications but would never comment on a specific child's case or criticize other professionals on live television. Maintain professionalism and focus on general education when speaking to the public. Question 30. A BCBA receives a subpoena for client records. What is the BCBA's ethical first step? A. Immediately release all requested records as per the subpoena. B. Contact the client's legal guardian to inform them of the subpoena and seek guidance. C. Consult with legal counsel regarding the validity and scope of the subpoena. D. Refuse to release any records due to confidentiality. Answer: C. Consult with legal counsel regarding the validity and scope of the subpoena. This question tests the ethical and legal protocol for responding to subpoenas for client records. The keyword first step indicates the initial protective measure. While subpoenas are legal orders, a BCBA's ethical duty of confidentiality means they should not simply release records immediately. The first step is to consult with legal counsel to ensure the subpoena is valid, its scope is appropriate, and to understand the best way to respond while protecting client confidentiality as much as possible. For example, if a BCBA receives a subpoena, they would immediately contact their lawyer to review it before taking any action. Always seek legal advice when faced with a subpoena to navigate legal obligations and ethical duties responsibly. Question 31. A BCBA is supervising an RBT who reports feeling overwhelmed and burned out, expressing concerns about their ability to provide quality services. What is the BCBA's ethical obligation? A. Advise the RBT to take a vacation. B. Immediately reduce the RBT's caseload to prevent further burnout. C. Discuss strategies for stress management and workload adjustment, and explore potential solutions. D. Document the conversation and monitor the RBT's performance more closely. Answer: C. Discuss strategies for stress management and workload adjustment, and explore potential solutions. This question addresses the supervisor's ethical responsibility to support supervisee well-being and competence. When a supervisee expresses burnout, the BCBA has an ethical obligation to address these concerns collaboratively, exploring strategies for stress management, workload adjustment, or other solutions that can support the RBT's well-being and ensure continued quality of service. For example, a BCBA might suggest the RBT take a temporary break from a specific client, adjust their schedule, or recommend resources for professional support. It's about proactive support to maintain competence and prevent service quality from declining. Question 32. A BCBA finds an old client file that was stored improperly, potentially compromising confidentiality. What is the ethical action? A. Shred the file immediately to prevent further risk. B. Secure the file properly and assess the extent of the breach and any required actions. C. Ignore the file, as it is from a past client. D. Inform the former client of the potential breach, regardless of its severity. Answer: B. Secure the file properly and assess the extent of the breach and any required actions. This question addresses the ethical responsibility to maintain confidentiality and proper record keeping. When a breach or potential breach is discovered, the ethical action is to immediately secure the information and then assess the situation to determine the extent of the breach and any necessary follow-up actions, such as notifying the client if required by law or ethical guidelines. For example, if old client records are found in an unlocked cabinet, the BCBA should secure them immediately and then investigate how long they were exposed and if any unauthorized access occurred. Always take immediate steps to mitigate harm and follow privacy protocols when confidentiality is compromised. Question 33. A BCBA creates a blog to share general information about ABA. Which of the following is ethically acceptable for the BCBA to publish on their blog? A. General case studies of their successful clients, with names changed. B. Information about their specific fee structure and billing practices. C. Anonymized data from their practice to support a point about intervention efficacy. D. Broad information about behavioral principles and applications of ABA. Answer: D. Broad information about behavioral principles and applications of ABA. This question focuses on ethical guidelines for public statements and social media, specifically regarding general dissemination of information. It is ethically permissible and encouraged to share broad, educational information about behavior analysis, its principles, and general applications to disseminate the science. However, sharing case studies, even anonymized, or specific financial details can be problematic, potentially violating confidentiality or being misleading. For example, a BCBA can write a blog post explaining reinforcement schedules or how to teach handwashing, but they should avoid discussing specific client progress or internal billing policies. Focus on general education and protecting privacy in all public communications. Question 34. A client's parents request that the BCBA provide services to their neighbor's child, who also needs ABA. The BCBA has an opening in their caseload. What should the BCBA consider primarily? A. Whether the BCBA's existing client's parents will be comfortable with this arrangement. B. The potential for a dual relationship or conflict of interest between the families. C. The convenience of serving two clients in close proximity. D. Whether the new client's needs align perfectly with the BCBA's specialization. Answer: B. The potential for a dual relationship or conflict of interest between the families. This question addresses the ethical guideline regarding conflicts of interest and third-party requests. While a BCBA might have an opening, providing services to a neighbor's child when already serving another child in the same neighborhood, especially when the families are connected, creates a potential for a multiple relationship. This could lead to shared information, perceived favoritism, or compromised objectivity. For example, if the families frequently interact socially, the BCBA might unintentionally share information or feel pressure from one family regarding the other. Always carefully assess potential conflicts of interest and dual relationships before accepting new clients, especially when personal or social connections are involved. Question 35. A BCBA is responsible for the overall design of an intervention plan. Who is ultimately responsible for the outcomes of that plan? A. The RBT who implements the plan daily. B. The client and their family, for their adherence. C. The BCBA who designed and oversees the plan. D. The funding source that approved the services. Answer: C. The BCBA who designed and oversees the plan. This question tests the ethical responsibility of a BCBA as the primary service provider and supervisor. The BCBA, as the certified professional who designs, supervises, and monitors the intervention plan, holds ultimate ethical responsibility for its implementation and the client's outcomes. While RBTs implement and families adhere, the BCBA ensures the plan is appropriate, implemented correctly, and modified as needed. For example, if a behavior plan designed by a BCBA leads to unintended side effects, the BCBA is responsible for identifying and addressing these issues, even if an RBT was implementing it. Always remember that the ultimate responsibility for client care rests with the supervising BCBA. Question 36. A BCBA is planning to use a brief timeout procedure as part of an intervention. What ethical requirement must be met before implementing this procedure? A. Ensure the timeout area is free from any potential reinforcers. B. Conduct a functional analysis to determine the behavior's function. C. Obtain informed consent from the client or legal guardian specifically for the use of timeout. D. Train all staff on the proper implementation of the timeout procedure. Answer: C. Obtain informed consent from the client or legal guardian specifically for the use of timeout. This question focuses on informed consent for specific procedures, especially those that might be considered restrictive or aversive. Anytime a procedure like timeout is proposed, the BCBA must obtain explicit informed consent from the client or their legal guardian, ensuring they fully understand the procedure, its rationale, potential risks, and alternatives. This is a critical ethical step before implementation. For example, before putting a child in a timeout chair for 2 minutes, the BCBA must ensure the parents have specifically agreed to this intervention as part of the overall behavior plan. Always ensure consent is obtained for each specific intervention being used. Question 37. A BCBA is asked to provide supervision for an individual who is related to a former client. What ethical guideline should the BCBA consider? A. The relationship with the former client makes it impossible to supervise. B. The passage of time since services with the former client ended determines permissibility. C. The potential for a dual relationship or conflict of interest. D. It is permissible as long as the supervisor is competent to provide the supervision. Answer: C. The potential for a dual relationship or conflict of interest. This question addresses the ethical guideline concerning conflicts of interest and dual relationships, even with former clients or their related parties. Providing supervision to someone related to a former client could create a complex multiple relationship or a perceived conflict of interest, potentially affecting objectivity and professional judgment. For example, supervising a college student who is the older sibling of a former child client might create a situation where information or loyalties could be inadvertently compromised. Always carefully assess the potential for dual relationships and conflicts of interest when accepting new professional roles, even with connections to past clients. Question 38. A BCBA is working with a client who makes excellent progress and is ready for services to be discontinued. However, the client's parents express strong anxiety about discontinuing services, fearing regression. What is the BCBA's ethical obligation? A. Continue services indefinitely to alleviate the parent's anxiety. B. Immediately discontinue services, as the client has met goals. C. Collaborate with the family to gradually fade services and provide resources for generalization and maintenance. D. Refer the family to a therapist for their anxiety, while continuing ABA services. Answer: C. Collaborate with the family to gradually fade services and provide resources for generalization and maintenance. This question tests the ethical guideline on discontinuing services in a client-centered manner. Even when goals are met, the BCBA has an ethical obligation to plan for a gradual and supported transition, especially if the family expresses concerns. This involves collaborating with the family, slowly fading the intensity or frequency of services, and providing strategies or resources to help maintain skills. For example, Instead of stopping all services for a child who has mastered communication, the BCBA might reduce sessions to once a week and teach parents how to continue supporting skill use at home. Support a smooth, client-centered transition, ensuring skills generalize and maintain. Question 39. A BCBA discovers that their supervisee is practicing outside their scope of competence. What is the BCBA's ethical responsibility? A. Report the supervisee to the BACB immediately. B. Provide additional training and supervision to remediate the skill deficit. C. Terminate the supervision contract and cease services. D. Document the concern and observe for further instances. Answer: B. Provide additional training and supervision to remediate the skill deficit. This question addresses a supervisor's ethical responsibility regarding competence and remediation for their supervisors. When a supervisee is found to be practicing outside their scope, the primary ethical responsibility of the supervisor is to provide the necessary additional training and supervision to remediate that skill deficit, bringing the supervisee up to competency. For example, if a supervisee is struggling with functional assessment, the BCBA should provide direct instruction, modeling, and guided practice until they demonstrate proficiency. Your role is to mentor and ensure your supervisors are competent to deliver services. Question 40. When should a BCBA obtain informed consent from a client or their legal guardian? A. Only at the beginning of services. B. Before implementing any new assessment or intervention. C. Annually, as part of a review process. D. Only for highly restrictive interventions. Answer: B. Before implementing any new assessment or intervention. This question clarifies the ongoing nature of informed consent. While initial consent is crucial, informed consent is not a one-time event. It must be reobtained or updated whenever there are significant changes, such as implementing a new assessment method or a new intervention procedure. This ensures the client or guardian remains fully informed and continues to agree with the current plan. For instance, if a BCBA decides to add a new token economy system to a client's plan, they must explain it and get consent before starting it, even if initial consent was obtained months ago. Remember to gain new consent for any new procedures. Question 41. A BCBA works for an agency that requires them to maintain a caseload of 30 active clients, leading to inadequate time for supervision and direct service. What is the BCBA's ethical obligation? A. Comply with the agency's requirements to maintain employment. B. Prioritize billable hours over quality of service. C. Advocate for a manageable caseload and ensure quality services, even if it means reducing client numbers. D. Accept the caseload and attempt to fulfill duties as best as possible. Answer: C. Advocate for a manageable caseload and ensure quality services, even if it means reducing client numbers. This question addresses the ethical responsibility to provide adequate and effective services, even when faced with organizational pressures. A BCBA has an ethical obligation to advocate for conditions that allow them to provide quality services and adequate supervision, even if it means pushing back against unreasonable caseload demands. Prioritizing client welfare and ethical practice always takes precedence over agency quotas. For example, if a BCBA's caseload prevents them from delivering the recommended supervision hours, they must discuss this with their agency and advocate for a reduction, rather than simply accepting the unsustainable workload. Your primary commitment is to the client's well-being and the integrity of your services. Question 42. A BCBA learns that a client's insurance company is denying coverage for medically necessary services. What is the BCBA's ethical responsibility? A. Discontinue services, as they are no longer funded. B. Continue services at no cost to the family. C. Advocate for the client's access to medically necessary services, which may include appealing the denial. D. Refer the family to a different provider who accepts their insurance. Answer: C. Advocate for the client's access to medically necessary services, which may include appealing the denial. This question tests the ethical guideline of responsibility to clients and advocacy for their well-being. When a client's medically necessary services are denied, the BCBA has an ethical obligation to advocate for that client's access to care, which can include assisting the family with appeals or providing documentation to support the medical necessity. For example, if an insurance company denies continued ABA therapy, the BCBA should help the family write an appeal letter, providing data and clinical rationale for why the services are essential. Your role extends to advocating for your clients' access to the services they need. Question 43. A BCBA is asked to conduct an assessment of a client without direct observation, based solely on parent report. What is the BCBA's ethical consideration? A. Proceed with the assessment, as parent report is a valid data source. B. Decline the assessment until direct observation can be conducted to ensure accuracy. C. Conduct the assessment but label the report as based solely on parent report. D. Request video recordings from the parents to supplement the report. Answer: B. Decline the assessment until direct observation can be conducted to ensure accuracy. This question addresses the ethical guideline regarding assessment practices and relying on sufficient data. Ethically, a BCBA must base their assessments and recommendations on directly observed and reliably measured data, not solely on indirect measures like parent report, especially for complex behaviors. Without direct observation, the assessment may be inaccurate or incomplete, leading to ineffective interventions. For example, if a BCBA is asked to assess aggression without seeing it firsthand, they should explain that direct observation is crucial and arrange to conduct it before making recommendations. Always strive for the most robust and accurate data collection methods in your assessments. Question 44. A BCBA is approached by a journalist who wants to feature a day in the life of a BCBA, including filming sessions with clients. What is the BCBA's ethical priority? A. Ensuring the client's identity is obscured or de-identified in the footage. B. Obtaining specific, informed consent from the client/guardian for media participation and filming. C. Highlighting the positive impact of ABA through the footage. D. Negotiating appropriate compensation for participation. Answer: B. Obtaining specific, informed consent from the client/guardian for media participation and filming. This question addresses ethical guidelines for media presentations and privacy. When involving clients in media, the most critical ethical step is to obtain explicit, written, and informed consent from the client or their legal guardian specifically for media participation and filming. This consent must clearly outline what will be filmed, how it will be used, and any potential risks. For example, if a TV crew wants to film a session, the BCBA must ensure the parents fully understand and consent to their child being on camera, not just that they understand the therapy. Always ensure clear and comprehensive consent for any media involvement of clients. Question 45. A BCBA receives a professional complaint from a former client. What is the first ethical step the BCBA should take? A. Ignore the complaint if it seems frivolous. B. Immediately contact an attorney. C. Review the BACB Ethics Code and relevant documentation, and consider an informal resolution. D. Call the client to demand clarification and threaten legal action. Answer C. Review the BACB Ethics Code and relevant documentation, and consider an informal resolution. This question addresses the ethical guideline for responding to ethical violations. When a complaint is received, the first ethical step is to calmly review the BACB Ethics Code to understand the alleged violation and to gather all relevant documentation. Attempting to resolve the issue informally and respectfully with the complainant, if appropriate and possible, is often the preferred initial approach. For instance, if a former client complains about a misunderstanding regarding billing, the BCBA should first review their records and calmly communicate with the client to see if it can be resolved without formal action. Always approach complaints professionally and seek resolution in accordance with ethical guidelines. Question 46. A BCBA is providing supervision to a graduate student who is concurrently completing their practicum hours at another agency. What is the BCBA's ethical obligation regarding the student's other experiences? A. Focus solely on the hours accrued under their direct supervision. B. Coordinate supervision with the student's other supervisors to ensure consistency and quality. C. Advise the student not to share details of other supervision experiences. D. Assume the other agency is providing adequate supervision. Answer B. Coordinate supervision with the student's other supervisors to ensure consistency and quality. This question addresses the ethical guideline for supervisory practices, specifically when a supervisee has multiple supervisors. When a supervisee is accruing hours under multiple supervisors, the ethical obligation of each supervisor is to coordinate with the others to ensure consistent training, avoid conflicting instructions, and collectively support the supervisee's development. For example, if a graduate student is supervised by two BCBAs from different agencies, those BCBAs should communicate periodically to ensure the student receives comprehensive and consistent feedback. Collaboration across supervisors ensures a holistic and ethical learning experience for the supervisee. Question 47. A BCBA is considering using an incentive system that involves food items. What ethical consideration is most important? A. Ensuring the food items are highly preferred by the client. B. Varying the food items to prevent satiation. C. Considering the client's dietary restrictions, health conditions, and cultural preferences. D. Using only small, bite-sized food items. Answer C. Considering the client's dietary restrictions, health conditions, and cultural preferences. This question highlights the ethical responsibility for beneficence and non-maleficence, particularly when using food as a reinforcer. When selecting any intervention component, including food items, the BCBA must prioritize the client's health, safety, and individual needs, which includes considering dietary restrictions, allergies, medical conditions, and cultural preferences. Ignoring these could cause harm. For example, if a child has a nut allergy, the BCBA must ensure no nut-containing treats are used, even if the child loves them. Always ensure that any reinforcer chosen is safe, healthy, and culturally appropriate for the client. Question 48. A BCBA receives a request for pro bono, free, services from a low-income family. What is the ethical guideline that applies? A. BCBAs are ethically obligated to provide a certain amount of pro bono services annually. B. BCBAs are not ethically obligated to provide pro bono services but may choose to do so. C. Providing pro bono services is unethical as it may devalue professional services. D. BCBAs should only provide pro bono services through established charity organizations. Answer B. BCBAs are not ethically obligated to provide pro bono services but may choose to do so. This question addresses the ethical guideline regarding fees and financial arrangements. While BCBAs are encouraged to contribute to society, there is no ethical mandate to provide a specific amount of pro bono services. However, it is ethically permissible for BCBAs to choose to provide free services if they wish, provided all other ethical guidelines, example competence, confidentiality, boundaries, are still met. For example, a BCBA may decide to offer a few hours of free consultation to a family in need if their schedule permits, but they are not required to. The decision to provide pro bono services is a personal ethical choice, not a mandate. Question 49. A BCBA is developing a presentation for a community group about common behavioral challenges in children. What is an ethical obligation for this public statement? A. Include specific client examples to make the presentation more engaging. B. Ensure all information presented is evidence-based and accurate. C. Guarantee that audience members will see improvements in their children's behavior. D. Use technical jargon to demonstrate expertise. Answer: B. Ensure all information presented is evidence-based and accurate. This question addresses the ethical guideline for public statements, specifically emphasizing accuracy and evidence-based practice. Any information a BCBA shares publicly, whether in presentations, articles, or social media, must be scientifically sound, accurate, and based on evidence. Misleading or unproven claims are unethical. For example, when presenting on tantrum reduction, the BCBA should discuss strategies supported by research, not just personal anecdotes or unproven theories. Always ensure your public statements are factual and reflect the current state of behavior analytic science. Question 50. A BCBA observes a client repeatedly engaging in a behavior that poses a significant risk to their safety, but the client's legal guardian is hesitant to approve an effective, albeit restrictive, intervention. What is the BCBA's ethical obligation? A. Respect the guardian's wishes and do not implement the restrictive intervention. B. Discontinue services, as the BCBA cannot ensure the client's safety. C. Discuss the risks of not implementing the intervention, explain the rationale for the proposed plan, and document the discussion thoroughly. D. Implement the intervention without full consent due to the safety risk. Answer: C. Discuss the risks of not implementing the intervention, explain the rationale for the proposed plan, and document the discussion thoroughly. This question tests the ethical balance between client autonomy, via the guardian, and the principle of non-maleficence, preventing harm. When a client's safety is at risk and a guardian is hesitant about a necessary intervention, the BCBA must engage in thorough, transparent communication. This involves clearly explaining the risks of not intervening, the rationale for the proposed plan, and documenting all discussions. For example, if a child is frequently running into the street, and parents are hesitant about a safety-focused intervention, the BCBA must explain the grave risks and ethical obligations for safety. While respecting autonomy, protecting the client from harm remains paramount, requiring clear communication and documentation. Question 51. A BCBA is asked by a former client to write a letter of recommendation for their college application, focusing on the client's academic achievements during therapy. What is the ethical consideration for the BCBA? A. It is acceptable, as it is a letter of recommendation for a former client. B. It is permissible if the client provides written consent for the specific information to be shared. C. It creates a dual relationship that should be avoided. D. It is outside the scope of a BCBA's professional role to write academic recommendations. Answer: D. It is outside the scope of a BCBA's professional role to write academic recommendations. This question addresses maintaining professional boundaries and the scope of a BCBA's practice. While a BCBA might have observed academic behaviors, their professional role is specifically focused on behavior analysis interventions, not general academic advising or writing academic recommendations. Engaging in such a request goes beyond the defined professional scope and could be seen as blurring boundaries. For example, a BCBA can write a letter about a client's progress in following instructions during academic tasks, but they should generally decline to write a comprehensive college recommendation about the client's overall academic potential. It's important to delineate between professional roles and avoid tasks outside your expertise. Question 52. A BCBA is developing a new data collection system for their agency. Which ethical principle should guide the design of this system? A. Maximizing efficiency to save time. B. Ensuring data security and client confidentiality. C. Collecting as much data as possible on every behavior. D. Ease of use for all staff members. Answer: B. Ensuring data security and client confidentiality. This question focuses on the ethical responsibility regarding client records and data. The primary ethical consideration when designing any data collection or record-keeping system is to ensure the security and confidentiality of client information. This means implementing robust safeguards to protect sensitive data from unauthorized access or breaches. For example, a new electronic data system must be password protected, encrypted, and compliant with privacy regulations like HIPAA. Always prioritize the protection of client data above convenience or volume. Question 53. A BCBA is providing supervision to a relative, example a niece, who is pursuing RBT certification. What is the ethical stance on this situation? A. It is permissible as long as the BCBA is competent to supervise. B. It is prohibited due to the inherent dual relationship. C. It is permissible if strict professional boundaries are maintained. D. It is permissible if the relative is the only available supervisee. Answer: B. It is prohibited due to the inherent dual relationship. This question directly addresses the ethical prohibition against supervising relatives. Supervising a relative creates an unavoidable dual relationship and conflict of interest that compromises objectivity and potentially exploits the relationship. The BACB Ethics Code explicitly prohibits such arrangements. For example, a BCBA cannot supervise their cousin seeking BCBA certification, regardless of how professional they intend to be. Always avoid supervisory relationships with individuals with whom you have a personal or familial relationship. Question 54. A BCBA is asked to share de-identified client data for a research study. What is the BCBA's ethical obligation? A. Share the data without concern, as it is de-identified. B. Obtain informed consent from the client/guardian for data sharing, even if de-identified. C. Share the data only if it benefits the client directly. D. Refuse to share any data, even de-identified, to avoid any privacy risk. Answer: B. Obtain informed consent from the client/guardian for data sharing, even if de-identified. This question addresses the ethical guideline regarding informed consent in research, even with de-identified data. Although data is de-identified, using a client's information for research purposes still requires their explicit informed consent or the consent of their legal guardian. This upholds the principle of respect for persons and autonomy. For example, if a BCBA wants to contribute de-identified treatment data to a university study, they must first get signed permission from the client's families, explaining how the data will be used. Always ensure proper consent is obtained before using client data for research, regardless of de-identification. Question 55. A BCBA observes a client repeatedly engaging in self-stimulatory behavior. The BCBA believes the behavior is interfering with learning. What is the first ethical step to address this behavior? A. Immediately implement a reinforcement-based intervention to reduce it. B. Conduct a functional assessment to determine the behavior's purpose. C. Teach the client an alternative, more socially appropriate behavior. D. Educate the parents on the negative impacts of self-stimulatory behavior. Answer: B. Conduct a functional assessment to determine the behavior's purpose. This question emphasizes the foundational ethical practice of conducting a functional assessment before intervening on any challenging behavior. The keyword first ethical step indicates the initial, essential action. Even if a behavior seems to be interfering with learning, understanding why it occurs, its function, is critical for developing effective, individualized, and ethical interventions that address the root cause, rather than just suppressing the behavior. For example, before trying to stop a child's hand flapping, the BCBA would assess if it provides sensory input, attention, or is an automatic reinforcement, then tailor an intervention based on that function. Always base your interventions on a thorough functional assessment. Question 56. A BCBA receives a request for a client's records from an attorney representing the opposing party in a custody dispute. What is the BCBA's ethical obligation? A. Release the records immediately, as it is a legal request. B. Refuse to release the records due to confidentiality. C. Inform the client's legal guardian and seek legal counsel before responding. D. Release only the portions of the records relevant to the custody dispute. Answer: C. Inform the client's legal guardian and seek legal counsel before responding. This question addresses the complex ethical and legal obligations when faced with requests for records in contentious legal situations. The primary ethical step is to inform the client's legal guardian about the request and then seek legal counsel to navigate the situation. This ensures compliance with legal mandates while also protecting client confidentiality and rights. For example, if a BCBA receives a letter from one parent's attorney requesting records, they should immediately contact both parents and their own legal advisor before releasing anything. Always protect client privacy and seek legal guidance in complex legal matters involving client data. Question 57. A BCBA develops a new behavior intervention plan for a client. Before implementation, what is the most important ethical step regarding stakeholder involvement? A. Obtain verbal agreement from the client's parents. B. Obtain written, informed consent from the client's legal guardian. C. Provide a copy of the plan to the RBT who will implement it. D. Present the plan to the client's teacher for approval. Answer: B. Obtain written, informed consent from the client's legal guardian. This question emphasizes the critical importance of obtaining written, informed consent. Before implementing any new behavior intervention plan, it is an ethical imperative to ensure the client or their legal guardian has received full information about the plan, understood it, and provided their explicit, written agreement. This protects the client's autonomy and ensures ethical practice. For example, if a BCBA creates a new plan for a child's bedtime routine, they must sit down with the parents, explain every detail, and get their signature before the plan goes into effect. Written informed consent is always required for intervention plans. Question 58. A BCBA is asked to endorse a new, unproven ABA curriculum on social media. What is the BCBA's ethical obligation? A. Endorse it, as it shows support for innovation in the field. B. Decline the endorsement, as BCBAs should only endorse evidence-based practices. C. Endorse it, but include a disclaimer about its experimental nature. D. Consult with a colleague to see if they have experience with the curriculum. Answer: B. Decline the endorsement, as BCBAs should only endorse evidence-based practices. This question addresses ethical guidelines for public statements, specifically testimonials and endorsements. BCBAs have an ethical responsibility to only endorse or make public statements about practices that are evidence-based and supported by scientific literature. Endorsing unproven or experimental curricula can mislead the public and is unethical. For instance, if a new miracle cure for autism is being promoted, a BCBA should not endorse it on their social media, even if it claims to be ABA-based, unless there's robust scientific evidence to support it. Always uphold the integrity of the profession by promoting only evidence-based practices. Question 59. A BCBA has designed a functional communication training, FCT, intervention for a client. What is the BCBA's ethical responsibility regarding the selection of the replacement behavior? A. Choose the easiest replacement behavior for the client to learn. B. Select a replacement behavior that serves the same function as the challenging behavior and is socially appropriate. C. Allow the client to choose any replacement behavior they prefer. D. Prioritize a replacement behavior that is convenient for the implementers. Answer: B. Select a replacement behavior that serves the same function as the challenging behavior and is socially appropriate. This question tests the ethical guideline regarding selecting, designing, and implementing interventions, specifically for challenging behaviors. The core principle for FCT is to identify a replacement behavior that serves the same function as the challenging behavior but is socially appropriate, ensuring the client's needs are met constructively. For example, if a child screams for attention, the ethical intervention is to teach them to tap a shoulder or say "excuse me" for attention, rather than just eliminating screaming. Effective and ethical interventions address the function of behavior with appropriate alternatives. Question 60. A BCBA identifies that they are not making adequate progress with a client due to a lack of specific expertise required for the complex behaviors presented. What is the BCBA's ethical obligation? A. Continue services and learn the necessary skills on the job. B. Seek consultation from another BCBA with relevant expertise. C. Discontinue services immediately. D. Refer the client to another professional without further involvement. Answer: B. Seek consultation from another BCBA with relevant expertise. This question addresses the ethical guideline regarding maintaining competence and seeking consultation. When a BCBA encounters a case that exceeds their current expertise, the ethical obligation is to seek consultation from a qualified professional who has the necessary knowledge or experience. This allows the BCBA to expand their competence and continue providing effective services to the client. For example, if a BCBA primarily works with children and encounters a complex feeding disorder, they should consult with a BCBA specializing in feeding disorders. Always prioritize client well-being by ensuring you have or can acquire the necessary expertise through consultation. Question 61. A BCBA is creating client progress reports for funding sources. What is the most important ethical consideration for these reports? A. Presenting the most favorable data to ensure continued funding. B. Ensuring the reports are accurate, objective, and reflect actual progress. C. Using technical jargon to demonstrate professional expertise. D. Focusing on the challenges to justify the need for more hours. Answer: B. Ensuring the reports are accurate, objective, and reflect actual progress. This question focuses on the ethical principle of veracity, truthfulness, and data integrity in professional documentation. All client records and reports, including those for funding sources, must be accurate, objective, and truthfully represent the client's progress, services provided, and any challenges. Misrepresenting data for financial gain is unethical and fraudulent. For example, a progress report should accurately reflect the child's skill acquisition rates, not inflate them to ensure insurance reauthorization. Always prioritize honesty and accuracy in all professional documentation. Question 62. A BCBA's personal social media account is accidentally made public, and a client's parent sees a post that they find unprofessional, though it does not directly involve the client. What is the BCBA's ethical concern? A. The need to avoid professional and personal dual relationships. B. The importance of upholding professional image and avoiding harm to the profession. C. The necessity of obtaining consent for all public statements. D. The right to freedom of speech in personal life. Answer: B. The importance of upholding professional image and avoiding harm to the profession. This question addresses the ethical guideline for social media use and professionalism. Even personal social media can reflect on a BCBA's professional image and the profession as a whole. BCBAs have an ethical responsibility to maintain a professional demeanor in all public statements and activities, avoiding anything that could harm the reputation of the profession or compromise trust. For example, if a client's parent sees a BCBA posting controversial political opinions or inappropriate content, it could erode their trust in the BCBA's professionalism. Always consider how your public online presence reflects on your professional role. Question 63. A BCBA has received a termination of services letter from a client's family without prior discussion or stated reason. What is the BCBA's ethical obligation? A. Immediately cease all services and close the client's file. B. Attempt to contact the family to understand the reason and offer a transition plan. C. Bill for all services rendered up to the date of the letter and do not contact them further. D. Report the family to the funding source for early termination. Answer: B. Attempt to contact the family to understand the reason and offer a transition plan. This question addresses the ethical guideline for discontinuing services. Even when a client or family initiates termination, the BCBA has an ethical obligation to attempt to understand the reason and offer a responsible transition plan to ensure continuity of care and support for the client. Abruptly ceasing services can be detrimental. For example, if a family sends a letter stating they are ending services, the BCBA should reach out to express understanding, inquire about the reason, and offer support for a smooth transition, such as providing recommendations for other services. Always prioritize a client-centered and supportive termination process. Question 64. A BCBA provides services in a client's home. The family occasionally offers the BCBA a meal when they are there during dinner time. What is the most appropriate ethical action? A. Politely decline the meal every time. B. Accept the meal as a gesture of hospitality to build rapport. C. Accept the meal if it's a potluck style or simple offering. D. Accept the meal only if the family insists multiple times. Answer: A. Politely decline the meal every time. This question addresses maintaining professional boundaries, specifically concerning gifts and hospitality. While seemingly small, accepting meals from clients blurs professional boundaries, can lead to a sense of obligation, and can be perceived as creating a dual relationship. The safest and most ethical practice is to politely but consistently decline such offers, explaining that professional boundaries require you to bring your own meals or eat before/after sessions. For example, if a family offers dinner, the BCBA should say, "Thank you, that's very kind, but I've already eaten/brought my own food to keep our sessions professional." Always maintain clear professional boundaries to protect the therapeutic relationship. Question 65. When supervising an RBT, a BCBA provides regular constructive feedback. What is the ethical purpose of this feedback? A. To ensure the RBT becomes independent as quickly as possible. B. To document performance for potential disciplinary action. C. To promote the RBT's professional growth and competence. D. To meet the minimum supervision requirements set by the BACB. Answer: C. To promote the RBT's professional growth and competence. This question highlights the ethical purpose of supervisory feedback. The primary ethical purpose of providing feedback to supervisors is to facilitate their professional growth, enhance their skills, and ensure they become competent practitioners. It's a key component of effective training and ethical supervision. For example, when a BCBA gives feedback on an RBT's prompting techniques, the goal is to help the RBT improve their prompting skills, not just to criticize. Good feedback is essential for developing skilled and ethical behavior analysts. Question 66. A BCBA is asked to conduct a functional behavior assessment, FBA, for a student in a school setting, but the school insists on providing a predetermined behavior intervention plan, BIP, template that includes only punitive procedures. What is the BCBA's ethical obligation? A. Decline the case, as the school's template is unethical. B. Conduct the FBA but advocate for an evidence-based, non-punitive BIP to be developed. C. Comply with the school's template to maintain the relationship. D. Implement the punitive BIP, but ensure parental consent is obtained. Answer: B. Conduct the FBA but advocate for an evidence-based, non-punitive BIP to be developed. This question addresses the ethical obligation to advocate for effective and ethical interventions, even when faced with institutional pressures. A BCBA must conduct an FBA to determine the function of the behavior, and then ethically advocate for a behavior intervention plan that is function-based, evidence-based, and considers the least restrictive alternatives, even if it means challenging an existing school policy. For example, if a school wants a punitive plan, the BCBA would explain why positive, function-based strategies are more effective and ethical, presenting data and rationale. Your ethical duty is to prioritize the client's well-being and advocate for the best, most ethical interventions. Question 67. A BCBA has developed a strong rapport with a client and their family. The family expresses interest in hiring the BCBA as a babysitter for their child on weekends. What is the ethical consideration? A. It is permissible if the BCBA obtains additional informed consent from the family for this new role. B. It creates an unavoidable dual relationship that should be avoided. C. It is permissible if the babysitting services are provided free of charge. D. It is permissible as long as the BCBA ensures the babysitting does not interfere with professional services. Answer: B. It creates an unavoidable dual relationship that should be avoided. This question addresses the ethical prohibition against dual relationships and maintaining professional boundaries. Becoming a babysitter for a client immediately establishes a personal, non-professional relationship that can compromise objectivity, create conflicts of interest, and blur the lines of the therapeutic relationship. This kind of dual role is explicitly prohibited. For example, if a family asks their BCBA to babysit, the BCBA must politely decline, explaining that ethical guidelines require them to maintain a strictly professional relationship to ensure the best possible care for the child. Always avoid any personal or social relationships that could compromise your professional objectivity. Question 68. A BCBA needs to store confidential client records. What is the most important ethical guideline for record storage? A. Storing records for at least 7 years. B. Using a cloud-based storage system for easy access. C. Ensuring the records are stored securely to prevent unauthorized access. D. Organizing records alphabetically for quick retrieval. Answer: C. Ensuring the records are stored securely to prevent unauthorized access. This question tests the ethical guideline on client records, specifically focusing on security. The paramount ethical concern for storing client records is to ensure their security and confidentiality by protecting them from unauthorized access, loss, or damage. This includes both physical and electronic records. For example, paper files should be kept in locked cabinets, and electronic files should be password protected and encrypted. Always prioritize the security of client information to maintain confidentiality. Question 69. A BCBA working in a rural area is the only BCBA available within a 100-mile radius. A new client is referred who has very specific, complex needs that are somewhat outside the BCBA's direct experience, but the BCBA is broadly competent in ABA. What is the ethical approach? A. Decline services and explain that a more specialized BCBA is needed, even if none are available locally. B. Accept the client, but seek immediate consultation and training to build competence in that specific area. C. Accept the client but inform them that the BCBA is not an expert in their specific needs. D. Refer the client to another state or a distant provider, even if it means significant travel burden. Answer: B. Accept the client, but seek immediate consultation and training to build competence in that specific area. This question addresses the ethical guideline regarding competence in underserved areas. In situations where a BCBA is the only available professional, they may accept a client whose needs are slightly outside their immediate expertise, provided they actively and immediately seek consultation, training, and supervision to develop the necessary competence. This balances the ethical obligation to provide services with the ethical demand for competence. For example, if a rural BCBA usually works with autism and is asked to treat a child with Tourette's, they could accept the case but must immediately seek supervision from an expert in that area. In underserved areas, actively building competence for the client's needs is key. Question 70. A BCBA plans to present de-identified client data at a professional conference. What ethical consideration is critical? A. Ensuring the presentation is engaging and informative. B. Obtaining informed consent from the client or legal guardian for the use of their data for presentation. C. Avoiding any discussion of intervention outcomes to protect privacy. D. Ensuring the data cannot be traced back to the individual client. Answer: D. Ensuring the data cannot be traced back to the individual client. This question addresses the ethical guideline concerning confidentiality in public presentations of data. While obtaining consent for data use, as in question 54, is foundational, when presenting data publicly, it is ethically critical to ensure that the de-identification process is so thorough that the data absolutely cannot be traced back to the individual client, even by someone familiar with the case. This protects client privacy. For example, when presenting a graph of skill acquisition, avoid including unique identifiers, specific dates that could narrow down the client, or unique circumstances that could easily identify them. Always prioritize robust de-identification to safeguard client anonymity in public forums. Question 71. A BCBA discovers that their agency's billing practices are consistently unethical, example billing for services not rendered. What is the BCBA's ethical obligation? A. Resign immediately without reporting to avoid personal liability. B. Continue to work but do not participate in the unethical billing. C. Attempt to resolve the issue with the agency first, and if unsuccessful, report it to relevant authorities, example BACB, funding sources. D. Report the agency to the media to expose the unethical practices. Answer: C. Attempt to resolve the issue with the agency first, and if unsuccessful, report it to relevant authorities, example BACB, funding sources. This question addresses the ethical guideline for responding to ethical violations, particularly within an organization. When faced with unethical practices by an employer, the BCBA has an ethical obligation to first attempt to resolve the issue internally, such as by discussing concerns with supervisors or HR. If internal resolution is not possible or effective, the BCBA must then report the unethical conduct to appropriate external bodies like the BACB or relevant government/funding authorities. For example, if an agency regularly bills for supervision hours not provided, the BCBA should first raise this with management, and if ignored, then report it to the BACB. Prioritize addressing ethical violations systematically to protect clients and the profession. Question 72. A BCBA observes a minor incident of non-serious non-compliance by a colleague during a session. What is the most appropriate ethical action? A. Document the incident and report it to the colleague's supervisor. B. Address the issue directly and informally with the colleague. C. Ignore the incident if no harm occurred. D. Discuss the incident with other colleagues to gather opinions. Answer: B. Address the issue directly and informally with the colleague. This question addresses the ethical guideline for responding to ethical violations by other professionals, specifically minor infractions. For minor, non-serious ethical violations, the Ethical Code encourages an initial attempt at informal resolution by addressing the issue directly and constructively with the colleague. This allows for immediate correction and professional growth without unnecessary formal escalation. For example, if a colleague accidentally leaves a client's data sheet visible for a moment, you would discreetly remind them of confidentiality protocols rather than immediately reporting it. Always seek informal resolution for minor issues first. Question 73. A BCBA is asked to provide supervision for an individual who is not pursuing BCBA or BCABA certification. What is the ethical consideration? A. It is permissible if the individual is an RBT. B. BCBAs can only provide supervision to individuals seeking BACB certification. C. It is permissible if the supervision is for a specific, agreed-upon skill set within the BCBA's competence. D. It is permissible only if the individual is a direct employee of the BCBA's agency. Answer: C. It is permissible if the supervision is for a specific, agreed-upon skill set within the BCBA's competence. This question addresses the scope of supervisory practice beyond BACB certification requirements. While BCBAs commonly supervise individuals for BACB certification, they can also ethically provide professional supervision or consultation to others, example teachers, parents, other professionals, on specific behavior analytic skills or programs, provided it's within the BCBA's competence and clearly defined. For example, A BCBA can ethically supervise a teacher on implementing a classroom behavior management system, even if the teacher is not pursuing BACB certification. Always ensure the scope of supervision is clear, competent, and ethical. Question 74. A BCBA is completing their annual continuing education requirements. What is the ethical purpose of continuing education for BCBAs? A. To maintain their certification with the BACB. B. To stay current with the latest research and best practices in the field. C. To network with other professionals and gain new clients. D. To specialize in a new area of practice every year. Answer: B. To stay current with the latest research and best practices in the field. This question highlights the ethical obligation of maintaining competence through continuing education. The primary ethical purpose of continuing education is to ensure that BCBAs remain knowledgeable about the evolving science and best practices in behavior analysis, allowing them to provide the most effective and up-to-date services to their clients. For example, attending workshops on new functional assessment methodologies ensures a BCBA's skills remain cutting edge. Ongoing learning is fundamental to providing ethical and effective care. Question 75. A BCBA determines that a previously effective intervention for a client's challenging behavior is now losing its effectiveness. What is the most immediate ethical action? A. Discontinue the intervention and try a completely new approach. B. Maintain the intervention and hope its effectiveness returns. C. Reevaluate the intervention and the behavior's function, then modify the plan accordingly. D. Increase the intensity of the current intervention immediately. Answer: C. Reevaluate the intervention and the behavior's function, then modify the plan accordingly. This question addresses the ethical responsibility to regularly evaluate and adjust interventions. When an intervention loses effectiveness, the most immediate ethical action is to reevaluate its components, consider if the behavior's function has changed, and then modify the plan based on new data. This ensures the intervention remains effective, individualized, and ethical. For instance, if a token board suddenly stops motivating a child, the BCBA should reassess the preferred items, the reinforcement schedule, or the target behaviors before making drastic changes. Always monitor intervention effectiveness and be ready to adapt based on data.